all Vicodin that's produced worldwide, and we only make up 4% of the population. I don't think Americans have more pain. We just don't want to feel anything, and doctors don't want us coming back numerous times to their office. So we're prescribed the highest level of painkiller we can get, rather than starting low and building if the lower pain medications are not working.
Right, because they have this need, and we're producing a need almost like a machine.
Yeah, part of what we have to do is we have to educate our doctors, but we also have to change the culture of just the citizens that live in the United States. We have forgotten that we shouldn't keep medications and hoard them, that they should be disposed of when you're done using them.
And people will put them in the water, and then we get pharma water, which is,
right.
I don't know if you know the statistics on that, but it's like millions and millions of gallons of water throughout the United States filled with nitroglycerin and hardcore drugs that have been prescribed, and people throw them in the water system, which is...
Right, and that is not a good way to dispose of them. But there was a lot of advertising that said you could dispose of them that way years
I didn't
ago.
realize that.
And so I think that's where people are coming from. We now know that that's not a safe way to dispose of them. And so a lot of drugstores are starting campaigns that you can bring your drugs back to them. I know Walgreens is a real big one that we've worked with before, and they have disposal sites at their drugstores. And almost every police department, at least in Macomb County, I'm not sure about Oakland, but in Macomb County, almost every police department, you walk in, you put them in a plastic bag, no questions are asked, and you're able to dispose of unused drugs very safely.
Okay, did you hear that? Throw your drugs away in a responsible manner. I think that's an important thing that needs to be said.
Correct. You can also do it at home by getting cat litter and crushing the pills and mixing it with cat litter so they can't be reused, or coffee grounds.
Oh, okay.
So if you're unable to get out and go someplace, you can't use that as an excuse for not being able to dispose of them properly.
The Adderall, then I see the Xanax to help people to sleep. I know a couple people really messed up on Ambien. And of course they're drinking and whatnot. It seems like the real issue, and then I think I've talked about this before on segments that I call basically pick your poison, where I'm not saying don't take your drugs or drugs are bad, but at the same time we need to be responsible. And you know, mixing all these drugs together, I call it the Birmingham heart attack, but because it's like when I hear somebody at 50 who's healthy, and I'm like, wow, they were on Viagra and Adderall and all these different things. Are these doctors just prescribing these?
Yeah, a lot of it is because of our old system of checking on drugs was very antiquated. It's called the MAP system. It's an automated system where doctors can look up what you're on. A lot of doctors don't use that. Okay, and that's one of the things that the Governor's Commission is trying to do, is make it mandatory for doctors to have to log on every time they're prescribing a narcotic.
Yeah, I read that yesterday
doctors,
about
but also
the MAP.
dentists and veterinarians.
Wow.
Because those drugs are available at all three of the locations. Wisdom tooth gets pulled, you're prescribed a painkiller. Your dog is sick, they're prescribed painkillers.
Oh, gosh.
And so you really have to attack it at all different levels. And so what we're proposing is that anyone who can prescribe narcotics has to log on to MAPS. They have to have a number, and they have to check with it before they prescribe.
That seems just like common sense.
It does, but we're getting lots of resistance from doctors because it takes time to do that. So we've even expanded it to allow nurse practitioners or one of the aides to be able to log on and do it for the doctor, print out what this person is on. Because mixing drugs can be very dangerous. So if you're seeing a doctor for your anxiety and they're giving you Xanax, and you're seeing another doctor because you have sleep problems and they're giving you something to help with sleep,
and if you're addicted, you're not going to want to be forthright with that information either. You're going to say, I need this.
Doctor shot.
Yeah, yeah, I've seen that too.
And then a doctor who does a surgery on you has no idea that you're being prescribed these other things. They give them to you, and sometimes it can create, if you're taking a benzo, an amphetamine, and an opiate, and a lot of doctors unknowingly are prescribing things that could really cause injury to a patient because they haven't checked and they don't know what other doctors are doing.